Good afternoon.
Hello.
We begin with Steve Alquist of Uprise RI. The Rhode Island Coalition for the Homeless released a model today projecting that at any given point in time, nearly 800 Rhode Islanders experiencing homelessness will require some level of emergency accommodations due to COVID-19. Are we ready for this?
We are. We have more than 200 rooms now, and if we need more, we'll find more. I mentioned at the beginning that we're receiving federal stimulus money. That's exactly, what it's for, to make sure that we take care of everyone and shore up our system, and that includes the most vulnerable.
Next question is from NBC 10 News. With schools closed now for the rest of the school year, has there been or will there be any guidance to youth sports or other youth activity groups about holding games or activities? Should they assume they cannot resume at least until June?
Yes, in fact, the Interscholastic League has said, for high school sports, that they were waiting to see what we would do about school, and if we were to cancel school, they would cancel sports. So I expect that now that I've made this announcement today, I think everybody will see that and start to make adjustments.
Tonya Signori of the RI Echo asks, this is for the doctor. There is hand washing, social distancing, etc. What else should Rhode Islanders be doing to help lessen the number of positive cases? Is there anything that you are seeing or hearing about that needs to immediately be stopped so that we can stay healthy?
The social distancing and the hand washing are priorities that we want to make sure people continue. Being able to wear face cloth coverings is also helpful for protecting the people who are around you. The key element continues to be, if you have symptoms of any type of illness, to stay home and call your doctor, call an urgent care clinic, and go ahead and get tested if you need to. We want to continue to focus on the key elements that will make the difference. Expanded testing broadly for everyone with symptoms, and as I have mentioned, in specific situations, we are instructing certain times when people without symptoms but who are connected should get tested as well, as I've shared in our congregate settings. Being able to assess that and get people into isolation and quarantining as quickly as possible is the key approach to helping to stop transmission of this virus.
Next question is from Tony Mendez at Poder 102 FM for the Commissioner. Can you share something positive that has resulted from distance learning that RIDE may recommend using next year?
Yeah, actually, there have been quite a few positive things that have happened, so we're really excited about that. What we've also learned is that we can expand, especially for our multilingual learners. Now we have access to different languages and materials in different languages that are virtual that we intend to continue to use, as well as for our students that have trouble a little bit with anxiety or being in school. We have seen the success of this model, and we're going to find different ways to continue some sort of distance learning for some of the kids that may need it as we move forward.
Sure.
Sí, la pregunta fue que si hay algo que hemos aprendido acerca del COVID-19 en términos de la educación, y la respuesta es que sí, hemos aprendido varias cosas. El primero es que ahora tenemos acceso a muchos recursos virtuales en el Internet, en muchos lenguajes que se puede para apoyar a los niños que están aprendiendo inglés como segundo idioma, y también para los niños que tal vez tienen ansiedad o estén bien enfermos, para cuando vamos a seguir hacia adelante, vamos a tener clases virtuales para ellos, para poder seguirle dando enseñanza, aunque estén en la casa, o diferentes maneras de tener accesibilidad a diferentes ambientes escolares que estén disponibles mundialmente.
Thank you, Commissioner. For folks at home, you may know that I've been reading questions that reporters submit in, and they come in real time up on this monitor. Jim Hummel has the following question. When will you reopen these closed daily briefings to reporters so we can ask follow-up questions in real time and in person, and not just the after call, which has often been chaotic? Virtually every other state has figured out a way to do it safely. Is it really about safety or control?
It's about safety, Jim, and I think you know that. When we change the guidelines after May 8th, we'll take a look at another format.
Next question is from Ethan Shorey of the Valley Breeze. Governor, the Board of Elections has indicated that there are discussions around changing the requirements for candidates on signatures needed to run in this year's election, but that it might take an executive order. Is that something you're considering?
I'll have to look at it. To be honest, I hadn't thought about it, but we are in close contact with the Board of Elections, and there are a number of changes that we're trying to make, including mainly allowing people to vote by mail. So it's something, if it's necessary, I'll consider it.
Our next question is from Eli Sherman. The White House has recommended 14 consecutive days of declining tests before reopening the economy. Tomorrow marks 14 days before May 8th. Will the clock restart each day? There's an uptick in new cases after tomorrow.
Great question, Eli. So as we've said from the beginning, we are looking at it more in terms of trends. So a few-day average, rather than just every day. And that's what I said when I began today. I keep hoping that the next day we'll start to see a trend downward. The good news is we seem to be plateauing, and the peak at this point doesn't seem like it's going to be nearly as bad as it could have been. And the other thing is, that's one measure. Right? So we're also looking at hospitalizations. Are they stable or are they increasing? Mortality, is it stable, is it increasing? Level of our ability of our healthcare system to handle cases. So it's soon to say. I'm still eager to think about making some changes after May 8th to start letting people go to work. So let's just keep going, doing what we're doing, looking at the data, and hoping that it averages out to a place where we're going to be able to do something.
Next question is for Dr. Alexander Scott from John DePietro. Dr. Meyer said in Massachusetts they're seeing an increase in amputations due to patients having an issue but put off going to the doctor and their conditions worsened. Have you seen evidence of people avoiding medical attention and not going to hospitals?
We haven't seen that in our data as of yet, but we've recognized the importance of making sure that message is clear. People should be staying at home, following the stay-at-home order, but there are specific routine checkups that are needed that people should continue to do, and make sure that you call your doctor to work that out. There are ways to do that through telehealth. There can be specific times where you can go see your doctors. Many of our urgent care clinics are still open if you have an urgent need to be addressed. Children should be continuing to get their vaccinations. Pregnant women should continue to get the checkups that they need. We want to make sure that while we are in this COVID response, we are not avoiding the key elements that's needed to stay healthy overall.
Doctor, please field this next question from Ian Donis of the Public's Radio. Is there a link between higher incidence among Latinos and African Americans and composition of workforce at nursing homes and congregate living? If so, what can be done?
We are assessing the fact that many people of communities of color are part of our critical infrastructure workforce, and the importance of taking into account how to help make sure our critical infrastructure workforce has the support they need, the ability to social distance where it's possible, the ability to have some covering over their nose and mouth, the ability to have access to hand washing and hand sanitizer, and the support they need if they need to be isolated or quarantined as well.
Next question is for the governor from Alan Gabberty of WBOB. The Rhode Island House GOP has called for critical reconvening of the Rhode Island House Oversight Committee to explore policies implemented during the state of emergency for good governance and transparency. What is your response?
Yeah, I think that's happening. I saw an announcement the other day, so I expect that will happen, and obviously, we look forward to that.
Next question is from Ryan Belmore of What's Up Newport. When do you plan to make an announcement regarding daycares and summer camps? Many Rhode Islanders are concerned about going back to work without school, daycare, or summer camps as a place for their children to go.
Thank you, Brian. So today we've put a lot of effort and energy into coming to today's decision around distance learning for K through 12 for the rest of the year and everything that went into that. As I said earlier, I'm not saying to parents, good luck, see you in September. What I'm saying to parents is, we're already hard at work on figuring out creative summer programs, as well as providing daycare and childcare. I hope to have something more to say next week about childcare, and then summer camps in the coming weeks. We have a little bit of time on that. But what I can tell you now is there will be summer programming. It will look different than last summer. There will still be social distancing required, so some of it will continue to be virtual. But we'll have programming, and I don't know. We'll figure out in the next few weeks. We'll come back to you with details on what that will look like. The next big focus is childcare and daycare, and that too will reopen in stages, just like everything else. We'll reopen in stages, and next week I'll have more to say about that.
Thank you. Next question for Dr. Alexander Scott from Patrick Anderson of the Providence Journal. Does the Health Department believe the coronavirus was present in Rhode Island before the return of St. Raphael's Academy's European trip? And do you have any data on all-cause deaths for March?
So the State Health Laboratory's capacity to test was developed and made accessible after the trip returned to Rhode Island. So there isn't a way to confirm whether or not there were previous cases in the state prior to that time. In terms of all-cause deaths for March, that's data that I don't have on me now, but we can work towards getting that to you, Patrick.
Steph Machado of WPRI 12 asks the governor, how do you go about reopening businesses while schools remain closed? You've previously expressed concerns about grandparents providing childcare. Isn't that inevitable if parents go back to work and kids stay home?
So it's a fantastic question, Steph, which is why the decision to decide whether to keep schools closed or open was such a difficult one. There are so many different factors, and you put your finger on a huge factor, which is younger kids. Childcare is necessary for their parents to go to work. And I looked long and hard at what, for example, Denmark is doing and other countries are doing. They only brought kids back in the younger grades, K through 3. So we explored every possible option. At the end of the day, after we looked at all the data and all the complexities and the potential health risks, given where we are right now in our peak, the fact is I probably could have maybe only opened schools for a couple weeks at the end. So again, I am certain it was the right decision, but we went through a discussion around what you're talking about. So what are we going to do? We're going to have to bring back online some childcare. We're going to have to ramp up more of our support with options like care.com and making sure people can get a babysitter if they need one. We're going to continue to ask employers to be extremely flexible, allowing people to continue to work from home, recognizing, I've been in touch with a lot of employers as well in discussing this. Every employer I talked to said, we'd rather you keep schools closed, and we'll work with our workforce to be flexible and figure it out. So it's an issue. I'm not going to deny it. It's an issue. We're going to get creative. We're going to figure it out, and we're going to make sure that everybody stays as safe as possible.
Mary McDonald of Providence Business News asks, how will you ensure that employers do not interpret the over 60 guidance as a reason to not hire someone that age?
Yeah, so we haven't made any guidance, and we're not going to put out any official guidance which we think would allow that to be an outcome. Also, additionally, you ask a good question, and it's not, we're about to enter a whole new era of work. Some employers are talking about doing temperature checks every day. There are different risks for people of different populations. So we are going, in our work of trying to figure out how to reopen the economy, we have a legal team looking at exactly these issues. Just yesterday, I had a call with businesses. They're looking for guidance as well. I promise you this, I'm not going to allow or stand for any discrimination in the workplace on the basis of age or gender or race or income level or your ability to get child care. We're going to do that. We're going to adapt We're going to be flexible, but discrimination is not allowed, period. And if it happens, we'll figure out a way to make sure that it stops happening and folks have a course of action if that's necessary. But I say that to, the next year, not just in Rhode Island, in America, frankly in the world, we're doing something that has never been done before. Closing an economy, reopening an economy. We're going to do it. There's no doubt about it. It's our reality, and we're going to adapt. Every day we're going to adapt. New problems are going to come up. We're going to find solutions to those problems. But the basic principles, keeping people safe, getting people back to work, not allowing or standing for discrimination or racism of any kind, those are the principles that are going to guide everything we do, and we're going to find solutions as we go. And we're going to make mistakes, and we're going to learn, and we're going to adjust.
Our last question today for this Thursday briefing comes from the Westerly Sun. Reporter Cynthia Drummond asks, some residents in the rural communities of southwestern Rhode Island have contacted us to say they're worried about private campgrounds opening for the season on May 1st. They're concerned that the campgrounds will draw visitors from out of state. Do you have a plan to allow private campgrounds to open?
Yeah, great question, Cynthia, and thank you for your question. So yesterday I announced that I have tasked Janet Coit, the director of DEM, with coming up with a plan as to how we're going to reopen all of our open spaces, campgrounds, beaches, parks, etc. And next week I will be making announcements, and part of that is campgrounds. So hang on for about a week or so. DEM is hard at work, and we're going to come out with something. I want people to enjoy open space. I mean, it's part of what makes Rhode Island great, but we're going to have to put, obviously, regulations around it.
Thank you, Governor.
Thank you.